See, the question is, Dr. Mohan Rao has asked the speaker, that's a question to me that regarding experience, my experience with Ryzodeg actually. So, the mic.
Sorry.
I've got at least patients in thousands who have used Ryzodeg, are using Ryzodeg, and would be using Ryzodeg. I've got a very good experience with Ryzodeg. It is very convenient for the patient. So usually I don't start with one dose. My style is to start with the BID doses, so that the 24-hour control is maintained along with the existing OADs. So it is a smooth insulin. So no breaks, no hustle and bustle, and there are no bumps and humps actually. So the patient never gets into hyperglycemia, as well as the patient never gets into hypoglycemia also. So with a better quality of life, and with a better convenience of taking the injection, and it has got time, the what we discussed, the mealtime flexibility, and it is the most effective insulin on the earth, being the only one, and the co-formulation around the world, the insulin degludec aspect available in the market with the same brand name, that is Ryzodeg. So it's available in both the use and throw flex touch pens. So most of my patients are on flex touch pens only, and where affordability is a little bit questionable issue, we write the pen fills, and they all the Novartis products, starting from the human mixture, that is the biphasic premixed injections. They fit into this Novopen 4 actually. And the current running pen is Novopen 4 with a lot of the specific and the special advantages when compared to the Novopen 3. So my patients are very comfortable with Ryzodeg, and I am very comfortable with Ryzodeg. So anything extra? So what is the last cutoff value of EGFR up to which IDegAsp can be given? So there is no cutoff. So you can give this particular insulin degludec aspect, that is Ryzodeg, to any patient with any degree of the EGFR. So you can use it even in the ESKD, that is end stage kidney disease, or the ESRD, end stage renal disease. And during dialysis you can give, during the transplant, kidney transplant, you can give. So all the conditions you can use Ryzodeg. So there is no cutoff for EGFR like metformin, like DPP4 inhibitors, like SGLT2 inhibitors, where we need to limit, so there is nothing of that sort actually. So, doctor, how can we manage postprandial glucose and fasting plasma glucose with Ryzodeg, as it is recommended only once daily? See, even it is recommended as once daily by Novo Nordisk, as it's a combination of both the basal insulin and the prandial insulin. Insulin degludec is the longest acting basal insulin on the earth so far, and icodec will be the next one, but it is still not into the market. Icodec is the latest molecule from, again, the basket of Novo Nordisk. That is the longest acting the basal insulin, which is used once in a week. So it has not come out as a commercial preparation. As of now, the degludec in the market is the longest acting basal insulin, and that is combined with the prandial insulin aspect. That is, when you see, suppose lunch is the largest meal, you can give it with lunch. or you think that the night is the largest meal, you can give it with the dinner, so that it maintains the fasting. The regular component maintains the fasting, and this particular insulin aspect will control the mealtime insulin. So even once a day insulin, the IDegAsp, that is Ryzodeg, is very much effective when compared to the basal insulin in controlling both the fasting and the postprandial glucose, wherein the only the basal part will reduce the hepatic glucose output in the liver. That is the mechanism of action. Thereby, it reduces only the fasting plasma glucose. It doesn't have any effect on the postprandial glucose. Whereas this particular Ryzodeg has an edge over the only basal insulin, as it has got both the components, the basal component as well as the mealtime component aspect. I think that clears the question. So per se, I use twice a day Ryzodeg, so that the patient will not miss out anything. So 24-hour control is my target. So that is the reason why I said in the beginning, my experience is I never use it as an OD preparation. I always use it as a BD preparation. So, doctor, can we give Ryzodeg initiations instead of going for second OAD, or can we control only with the tablets? Which therapy is best for diabetic patients? Is it the OADs or insulin? This is asked by Dr. G.V. Shivareddy. So, it's a very good question actually, Dr. Shivareddy. So, as of the recommendations say, as long as insulin is not required, it is not going to exert any additional benefits like the cardiovascular benefits and all are not seen with insulin. See, the patient is on one OAD, two OADs, three OADs, then not controlled. You better go for Ryzodeg. Or the A1C is around 9 or more than 9, straight away go for Ryzodeg. Once the A1C comes down, you slowly decrease the units of Ryzodeg, add metformin, add DPP4 inhibitor, add SGLT2 inhibitor, slowly take off Ryzodeg. And the second part of the question is, if the patient is able to control with the tablets, as long as the number of the tablets doesn't exceed 3, that is one metformin or one sulfonylurea or either DPP4 inhibitor or SGLT2 inhibitor, or metformin DPP4 plus SGLT2 inhibitor, 3 oral drugs, the patient is able to maintain the glycemic triad, that is the reasonable fasting plasma glucose, that is 80 to 130 milligram per deciliter, as recommended by the American Diabetes Association. And again, he maintains a postprandial glucose of less than 180 milligram per deciliter, again recommended by American Diabetes Association. Even the latest 2024 guidelines also say that. And as long as the patient maintains an A1C of around or less than 7, as per the American Diabetes Association, you don't need to start insulin unless the patient shows the signs of insulin deprivation. That is, when the patient is not having the enough insulin, though the blood glucose is okay, he feels a little bit tired, he feels like he is losing his weight, and literally they lose weight when the patients are insulin deficient, or when there is comorbidities like complications, comorbidities like hypertension, dyslipidemia, or other comorbidities, or the complications like diabetic kidney disease. The patient is maintaining a good glycemic control also. At that particular juncture, it is high time you should use at least once daily Ryzodeg or twice daily Ryzodeg. So, alone with the tablets, as long as the patient is maintaining a good health, they can be maintained with only tablets. You don't need to go for insulin. Insulin is not going to offer any additional benefits. That is backed up by the evidence-based medicine, the landmark trial, the origin trial done by the Sanofi people. That is the longest trial that is done in 12,885 patients over a period of 7 years. So, over a period of 7 years, this did not exert any cardiovascular benefits. See, now it is a funda that the USFDA says always go for a molecule which has got cardiovascular benefit. That is the reason why in 2008 it introduced and it made mandatory that every molecule that reduces the glucose levels that is used in type 2 diabetes should have the characteristic feature of the reducing the cardiovascular morbidity and mortality. So COOTs became the cardiovascular outcome trials became mandatory after 2008, and of course after 2000 the 2020 it took off that particular mandatory cardiovascular outcome trial, and it has given some criteria that like the patient the at least 600 patients should be included whose age is more than 75, and at least 600 patient must be included where the EGFR is compromised, that is the renally compromised patients must be included, and another 500 patients with cardiovascular compromised patients must be included. It has given some criteria so that the study, though it is not called a cardiovascular outcome trial, but it amounts to more than cardiovascular outcome trials as per the USFDA. So, in that aspect, the Ryzodeg or any other insulin is not going to exert any additional benefits. But some cases, like okay, like you say, you take diabetic foot, where the patient is maintaining 6.5 A1C, also you are supposed to stop all the drugs and put the patient only on insulin. And I would like to love to initiate this particular Ryzodeg in that particular subset of patients with infections. The acute admissions in the hospital settings, that is the ICU settings. These are all the conditions wherein you should, though the patient maintains an absolute the euglycemia, that is the fasting plasma glucose is maintained and the post lunch is maintained and the A1C is maintained. Still then the acute conditions you are supposed to stop the drugs as long as the patient is hospitalized, whether in the ICU setting or non-ICU setting. The patient has to be insulin, and at the time of discharge you can give a OAD trial along with basal insulin for at least 1 to 2 weeks, and when the patient comes to you for the subsequent reviews, everything is okay, you can take off the basal insulin, you can just get back to the old regime with the OADs, either 2 OADs or 3 OADs, whatever it may be, but fourth OAD is not acceptable. That is only the dictum I say. After 3 OADs you are bound to use insulin, whatever it may be. If the patient is not affordable to go for this particular Ryzodeg, you have to use the economical insulins, the human insulins, the genetically the rDNA engineered human insulins are as good as the other insulins, and the analogs have got some advantages absolutely, because the quality is totally different, the convenience is totally different, whereas the biphasic premixed human insulins, they are to be injected 30 minutes prior to that, because they are in the form of hexamer. They need to, after injection, it has to break down to dimer, and dimer has to break down to monomer. Monomeric insulin is the active principle of the insulin. So that takes a period of 30 minutes. So inevitably you have to take these human insulins 30 minutes prior to each meal. Whereas this particular form is already in the form of a monomeric in the form. So you can take it just 5 minutes prior to the meal, the Ryzodeg. or you can take, if you forget and you start your meal, you can take it in the middle of the meal, or you forget totally, and after some time you remember that you have missed out your insulin. Even then also you take, your blood sugars are 100% maintained with this Ryzodeg. So these are the greatest advantages of analogs over the human insulins. But my intention is not to give a loud message that everybody should be on the analogs and Ryzodeg. The other insulins are very inferior to that. That is not my intention. 90% of the Indian population, 90% of my patients are on the biphasic premixed human insulins, and only 10% are on the analogs. And my favorite analog is earlier, before the era of Ryzodeg, I think 2015 they launched, 2014 or 2015 they launched this Ryzodeg. Prior to that, I used to write the Novomix, that is the insulin aspart, a combination of insulin aspart and the combination of the protominated aspart, that is Novomix. And once it has come, so I started ignoring Novomix because it is much superior. It's a co-formulation, and the one and only co-formulation in the world is Ryzodeg, and it has got all the advantages over the existing, the analog insulins of various companies, including Novo Nordisk also. Nothing can beat this particular molecule, the Ryzodeg actually. So, and that completes the answer of Shiva Reddy. And Dr. Mohan Rao says, thank you, Dr. I'm honored to attend the webinar of Dr.Sepuri Krishnamon. The topic and the question answers were excellent, and speaker has elaborated all my doubts on diabetes management. Thank you. Yeah, you're most welcome, Dr. Mohan Rao, sir. And Dr. G.V. Shiva Reddy, I think, is my good friend from Kadapa, it seems. Thank you, Doctor. This session is the best one in which I have attended for Novo Nordisk. Thank you. Thank you so much, Shiva Reddy. Thank you for the wonderful compliment, I think.
This woman also given.
Where is it?
He can talk now. Unmute himself, he can talk. He left.
Okay. So these are the.
Yes, these are the.
Yeah. Any other questions? You can unmute yourself and ask me straight away. You can face to face. We can have the session. And I once again, from my bottom of my heart, thank you, my dear professional colleagues, for your wonderful patient listening, and the number of attendees is around some 30 actually. And in the middle, someone left, and it is as of now it is 18, I think. Yeah.
It is 22, sir.
22.
22.
Yeah, for a webinar, 30 is too high number, and even now 22 are there. I'm happy about it actually. So people think that insulin is a tough topic, but it is the easiest topic on the earth. Once you put it into your practice, the art of the prescribing insulin, and the initiation of insulin, and intensification of insulin, and maintenance of the dosage of the insulin, it becomes so easy that you have a smooth riding or smooth driving. So, if there are no questions, we can wind up the session. And once again, thank you so much, Dr. Mohan Rao, and I think my dear friend G.V. Shiva Reddy, if I am right, he is from Kadapa only, for his wonderful compliment, and for the compliments by Dr. Mohan Rao sir and my friend Shiva Reddy. Thank you so much. And I think with this, there are no more questions. And my friend has joined, the Dr. Umair Hussain from Saudi Arabia. Every day he joins my the speaker program, and somehow he left. Now might be some the fasting reasons, the rosa is going on. So that might be the reason actually. So can we
Close.
close the sessions? So once again, I thank the Nonadis people. My Nonadis Karmi, Syed and Mr. Abdul Hamid, the manager, and thanks Nonadis for giving me the opportunity to be the speaker of this evening. On behalf of my best staff, Dr.Sepuri Devi, I offer our deepest gratitude to the professional colleagues. Thank you so much. Then we both sign off. See you in the next session. Probably tomorrow. Every day I have a session, but only thing is I don't get all the invitations. That is the reason I'm not able to post it on the social media. The only ones I get, I can post so that you can always have a chance. If time permits, please attend my sessions. You can clarify. We'll have a nice environment. And pleasure to see doctors like G.V. Shiva Reddy, is a legendary diabetologist actually, and Dr. Mohan Rao sir. Yes, thank you so much.